they've been on injections, they've switched to cream, and they wouldn't go back.
Okay, so welcome back to the TRT and Hormone Optimization YouTube channel. And as a guest with us is Dr. Max Draper. Welcome with us, Max.
Hi, Stephen. Yeah, thank you very much for having me. It's a pleasure to be on the channel.
Likewise, thanks for coming. So today we're going to talk a bit about your personal journey since you were a GP before and then you switched to being a TRT expert, really. So tell us more about that.
Yeah, so I was a classically trained GP. I went through medical school, junior doctor years doing my GP training. And then that was about 10 years ago. So I was a GP for about 10 years before leaving to pursue this all full time. And what happened to me was basically I suffered from low testosterone. And being a GP, perhaps, I should have known more. But I didn't realize for quite some time, nor did other GPs that I'd seen realize that actually what I was suffering was low testosterone. And even that is in the remit of me having had testicular cancer and losing a testicle. So I think it's a useful, story to know that the knowledge isn't out there. So you've got to really be careful on who you seek out to help, really.
Yeah. And at what age did you become hypogonadal?
Yeah, so I had testicular cancer at 29. I lost my left testicle. And I would say in hindsight, maybe about 6 months or a year after the surgery, I started to notice something, a little bit. In hindsight, it was a bit more irritable, a bit more anxious, just a bit more tired than usual. Things got a lot worse for me after I had viral meningitis. That was about 2 years post-surgery. And what kind of inspired my sort of passion for this area is after viral meningitis, I lived in a really bad place for about 2 or 3 years. A lot of anxiety, very poor stress resilience, tired all the time, very poor quality of sleep. And I tried everything to get better, all of the well-being stuff. I meditated, gratitude diary, even was put on an SSRI for a while. Just did classic, yeah. And nothing was helping. I've always been fairly active, avid gym goer and things, and I was getting weaker in the gym, putting on a lot of belly fat. So it's quite a lot of classical symptoms of low testosterone. But, my message is often, I was a GP, my wife's a GP, my dad's a GP. I saw about 3 GPs during that time. So it's about a 3-4 year period. And none of us, including myself, so I don't, I'm not slagging off GPs, it's myself included, knew that it could possibly be a hormonal issue. And when I went on TRT, basically within weeks, my life was, completely changed. And that's what inspired my whole career change, really.
And didn't the surgeon who removed the cancer or the oncologist maybe warn you that it would be a possibility to have these issues?
No, it wasn't really mentioned, to be honest. I think the idea in medicine still exists today, and is that you can get by on one. I think that seems to be the sort of common consensus, which obviously is not the case. Yeah.
All right. And so, how did you find help? Did you find a professional easily that could help you with that?
Yeah, well, eventually what happened, basically, I had a few testosterone levels checked during that sort of four year period. They were kind of normal, but looking back, even by the guidelines sake, they could have been treated. But it was when it became red that it inspired an endocrinologist to be, their help instigated. I was initially actually put on the gels, which did a little bit, but then that's when I ended up looking around privately for options, because I'd already started to try and sort of delve into this area, learn a bit more, learn why was testosterone so significant? Why was even the gel helping? And that's where I came to Alphagenix, and that was a while back now. And it's been a hell of a journey. It's certainly inspired a lot of self-education, learning about this area in depth. And your channel's been very helpful in that sense, because it's certainly, taught me things that I'd never even come across at med school or GP training about things like, SHBG, testosterone, DHT conversion, all of these things really. So it's been about 3-4 years now of pretty much constant, quite obsessive learning for me.
And why did you make the switch yourself from GP to being a TRT expert now?
Yeah, so I started working for Alphagenix in 2022, and that was kind of half and half, so I was doing some general practice work. And how do I put it? For many reasons, I kind of fell out of love with general practice, and not just necessarily general practice, but maybe some aspects of modern medicine. And the Alphagenix work was just so enjoyable. I get time with guys. You can really make a difference, a big difference to lives, as you know. So eventually, and about 6 months ago, ended up leaving general practice, doing this full time. And it's just, I love the work, basically.
Yeah. Did the COVID thing had something to do with you leaving the general practice?
It may have done. It may have sort of maybe helped me lose my faith in some aspects of modern medicine. Yeah.
Lose your trust, especially, I guess.
Yeah, possibly.
Yeah, same here, man.
Yeah.
What would I ask? Weren't you worried about fertility, or did you already decide you had enough kids?
Yeah, we'd had 2 by the point I went on TRT, and to be honest, this is what I say to guys now: is the problem with when you have low testosterone, the idea of having further children can be quite overwhelming. Whereas when you get on TRT, feel more resilient, then your mind may change. So you have to kind of have an idea about that. But yeah, you're not. Fertility is not kind of, if you go on TRT, you're going to be infertile for good. There are ways to, work with it rather than just say, no, you can never consider TRT if you want more children. I think that's an important message for guys.
What advice would you give to young men that discover that they have these low T symptoms?
I think an important thing is to consider, where do you go? Because the problem is, like I said, multiple GPs involved in my case, including myself, and we didn't think it could be a hormonal issue. So I think seek out people who do this regularly and have a degree of expertise, because you want to get a proper workup. You want to get all of the correct bloods done, and you want to be able to sit down with someone and actually say, what do these bloods look like? But actually, how are you feeling in comparison to these bloods? Because the blood is just, a snapshot in time. This is your level here. But actually, we know about androgen receptors. We know about endocrine disrupting chemicals, disturbing everything. What that blood means can be very different. What that level means from one person to the next can be very different. So you've got to get someone who knows what they're doing, really.
I guess in the UK, that's not the NHS direction.
Yeah, I think the NHS are very much stuck behind certain levels and certain guidelines, really. And even then, there is a little bit of individual variation. I never quite understood, and this was, I guess, one of many reasons for leaving general practice, is I got very frustrated with referring guys with what I considered to be low T and low T symptoms. And then the treatment just was like, oh, we'll repeat it in 6 weeks. You say, well, what are we seeing in 6 weeks' time? And there was almost like this testosterone phobia that still exists. It's kind of like, that's only the last resort. And it's like, well, why? If they're feeling rubbish, they've got, bad, bloods, what are we doing? Why are we kind of making them suffer? So that was part of the frustration, really.
You told me you are on injections now, or did you ever use the transscrotal cream?
Well, I've certainly considered it. Yeah, I've certainly considered it. I switched from the gels fairly quickly onto Cypionate with Alphagenix. And I suppose it's one of those things where, I would love to switch over completely just to try it out, I think, almost in a sense. It's kind of like, but because I feel great now, it's kind of like, well, do you want to switch and see and dial that in again? But probably something I'll do in the future. I really like the ideas of the cream. I've got a few guys on it, and they swear by it. They absolutely love it. you know, they've been on injections, they've switched to cream, and they wouldn't go back. So I think a lot of guys really do love it.
Mhm. I guess in the UK, just as in the USA, you see a lot of obese men coming in with low T symptoms as well. How do you get those dialed in? Do you work on their diet, workout, and so on as well?
Yeah, I mean, that's what I like about the work is you can really take a sort of rounded view of the individual circumstances rather than just having sort of 5-10 minutes just to be like, right, here's a plaster for this symptom, go off and keep living the same lifestyle. So, you know, we've got like a strength and conditioning coach aligned with the team as well. So you've got to, I mean, TRT doesn't work unless you take an holistic approach, really. You've got to really look at all aspects of lifestyle. You can't inject testosterone and expect to feel good if you're just sat on your butt watching Netflix and eating pizza all the time. It's really got to be a lifestyle venture rather than just purely injectable. And some guys, they come to us and they're already doing everything right.
Mm-hmm.
It's just that they have poor levels of testosterone for, you know, one of many reasons, in which case it often can just be, right, we'll get you dialed in and you're going to really, you know, run with this. Other guys, it's more work. You know, you've got to look at all aspects of health. So yeah, it's a mixed bag, but you've got to look at everything basically.
What if obese men can't be motivated to lose weight or work out or watch their diet more closely? They just want the testosterone, and they might think this will fix everything. How do you go about that? Because me too, in my practice, I see a lot of obese men, and sometimes they ask, how do I lose weight, doc? But if you say just eat less, work out more, you just, well, I can't, I have this or this, I don't have time to do this. So they're always finding ways not to do it.
Yeah, I think it just has to be, I suppose, an honest discussion, because at the end of the day, if you're paying privately for treatment and you can honestly, you know, say that you're not going to tackle any other aspects of lifestyle, well, the treatment results are going to be pretty limited, you know, at the end of the day. So it's kind of like, well, I think you just have to spell it out and just say, look, you know, at the end of the day, if you're not going to make any of these lifestyle interventions as well, it's going to be really difficult for me to honestly tell you that I'm going to make a hell of a lot of difference to quality of life. And that includes everything, you know, libido, energy, sleep, all of those aspects. You know, TRT is not just going to reverse all of that if you just carry on down the path you're on. Hopefully, you know, in over a prolonged consultation, you might be able to make a difference. You might be able to just spell it out, really. Yeah. I like to just give everybody the information. You know, I end up rambling on and talking for a long time, but it is kind of a case of, at least if you take in maybe 50% of what I'm telling you, then at least you can make an informed decision, I guess.
With Alphagenix, tell me, what do you guys do there? Just the hormones, or do you also, I don't know, peptides, weight loss? I don't know, Ozempic and things like that.
Well, I mean, primarily what we look at is testosterone replacement therapy, with an eye to, you know, holistic supplementation, everything like that. Peptides, not so much. In the UK, it's quite difficult to you know, advise on peptides as such, or certainly not prescribe them. Ozempic, something that we can direct people towards. I mean, Ozempic and TRT is like really can be a really useful combination to instigate, because, you know, the TRT can aid in the muscle, you know, the muscle maintenance or gain, whilst you lose fat. Hopefully, I suppose that's the ideal scenario. You lose the fat, but you don't lose the muscle. So there are nice combinations. I primarily deal with things like, you know, TRT, so creams, injections, primarily cypionate or compounded cream. And then we look at things like even like metformin, telmisartan, Cialis, that sort of stuff. I love Cialis. I think, you know, tadalafil, I think it's a great medication. It grows very nicely alongside TRT, particularly for the gym goers as well. The muscle pumps are great. And then other things we can kind of direct people in a direction of, really, I suppose, how I'd say it.
Do you guys have the same stance on things like not to have donate blood, not using aromatase inhibitors, like our American guest I've already had on the channel?
Yeah, absolutely. I think I spend probably 50% of my time explaining why not to worry about estrogen. I think that's primarily, if there's something that's repetitive in my consultations, it's probably estradiol is nothing to worry about. It will naturally be over the lab ranges. It's an intracrine hormone, etc., etc. I probably say that at least several times every day. And yeah, same with the DHT blockers. Some guys will ask me about, hair loss, and they'll say, is it okay to take, finasteride? Is it okay? I don't even like using them topically, to be honest. I'm just quite a simple guy at the end of the day. I don't like blocking hormones. And honestly, if you look into the I mean, I won't go on a rant. I'm sure everyone's watched Jordan Grant's videos. They're awesome. But if you look at the physiology and the management that the organ has, let's say the prostate, for managing local levels of DHT and things like that, how you could imagine just by taking a pill that you're going to somehow, not screw with the balance within the body is just crazy to me. It's so complicated. So I think just taking a pill is just a bad idea in that circumstances. We don't have, it's so detailed, we don't even understand fully how the body works in terms of controlling these local, hormonal levels. So just to take a pill to nuke the whole thing is it's crazy.
Yeah, I tell it to patients that ask for finasteride, same thing, because a lot of young men do research online and then they don't understand the risks involved in taking that, messing with your hormones for such a really stupid thing like hair loss, which is not even a disease, but a normal physiological thing for men. So,
well, I think I've experienced that online because I am thinning quite a lot. I must have searched for, shampoos or something. And now every time I go online, I'm advertised, like topical finasteride or something like that. And I'm just like, just don't risk it. I just don't, just let it be.
Yeah, I tell patients that ask for it, I wouldn't dare taking it. I just accept male pattern born baldness. You can do it too. Just I prescribe just the minoxidil, really. Okay,
I think it's the look nowadays. I honestly think a closely shaved head is in the range, man. I think it's the cool look nowadays.
Yeah, sure. And maybe last point on hematocrit. Is it the same? Because I know a lot of GPs are easily worried as soon as the hematocrit goes over 53%, something like that. So do patients come to you for their controls, or is it via the GP?
No, yeah, we monitor the sort of the blood counts, the hematocrit, everything, regularly. We don't need to worry ourselves over hematocrit. What I use it as is you don't need to donate blood. Secondary erythrocytosis from TRT is not a risk for blood clots and things. But what it might instigate is you might want to think about, well, if it is really high, why is it really high? Is it just the TRT, or is there, something else going on? And I think, sleep apnea is a big one that's very missed in general population. I think even insulin resistance has a role there as well. So general health, sleep apnea is a big one. And again, hydration at the time of the test. Obviously, a lot of guys fast for the blood test, or, I've got quite a few intermittent fasters. If you're not hydrated, it's going to skew the result as well. So there's a few things to talk about, but certainly not giving blood. Yeah.
Okay, Max, thank you so much for sharing your personal story. If people want to get in contact with you, how to do that?
So it's alphagenix.co.uk. You can go to the site there and see what we do. And then there's at Alphagenix or at MaxYourT is my Instagram. And yeah, that's probably the main areas to look at, really.
Okay, I'll put the links to your site in the description of the video.
Brilliant.
Okay, Dr. Max Draper, thank you so much, and talk to you next time.
Thank you very much for having me.